Hi guys, this is Dr. Rishi Desai at Osmosis, and I'm here with Dr. Roger Schweltz, who is an assistant professor at Loma Linda in internal medicine and an associate professor at UC Riverside. Also a pulmonologist, sleep specialist in Redlands, and of course, many of you know Dr. Schweltz from MedCram. He's the co-founder and one of the primary instructors at MedCram. Thank you so much, Roger, for joining me today. How are you?
Great. Thanks, Rishi, for having me on. I'm a real fan of Osmosis.
Yeah, I appreciate that. So, I came across MedCram a number of years ago. I was super impressed. I thought that your style was both informative and also really entertaining and interesting, which is something that is, obviously super lacking in medical education today, which is probably why you got involved. But I don't want to tell your story. Just tell me your story. Like, what got you first excited about MedCram and got you even doing this kind of thing that's so different from what most established doctors like yourself are doing?
Well, I teach PA students, and I was lucky enough to have a PA student by the name of Kyle Allred, who's the other co-founder, as it turns out. His dad was involved with online education, did a lot of wilderness medicine things. And, one day he told me, he said, Dr. Schwelt, you should be on YouTube. Students don't open textbooks like they used to. They don't go to the library and check out articles. They go to YouTube, they go to Google, they search the internet for this sort of stuff. And I have to kind of confess it was a little bit self-serving because every month I get a new PA student. And the first week I was educating them on how to read a pulmonary function test and, what is acute renal failure and the different mechanisms of hypoxemia. And I felt if I could only just, put this in a recording and I just assign them as they would go home that night to look at this video and then come back to me the next morning and we go over it, it would be so much better. So that's what I did. I first started with acid base because that was the most daunting and confusing aspect. And I tell you, it's so rewarding to sit down and explain acid base in a logical progression of understanding that when people finally get it, they're like so excited. It's like they're 5-year-old learning how to tie a shoe. The thing that got me involved was Kyle. The thing that got me involved was just the satisfaction of seeing the aha light go on in somebody's head. I can see that in real life when someone is in front of me. I can't see it all the time when we do it on the video, and you know that just as well as I, Rishi, because we do the same thing. But I know it's happening, and it's fulfilling.
So let's go with your acidosis example or metabolic acidosis or alkalosis video type example. When you're making that video, do you think to yourself like, oh, I want to make this video for a medical student or respiratory therapist, or I want to make it for a nurse? Does that factor in? And if so, how do you try to juggle those different types of students in your mind?
It's a good question. The first thing about giving a talk is to know your audience. And with an audience that's so broad, at first, I was kind of aiming for the medical student and the PA student level. However, what I aimed to do in that was I wanted to explain it so thoroughly, so well, but yet not include extraneous information. That what I found was that it can really be picked up at any level. Obviously high school might be a little bit difficult. You have to understand what pH is and what a PCO2 is and a PO2 and a bicarb. But once you understand that, it's just basically arithmetic and numbers. But it's going through a logical progression, knowing that if the anion gap is X, then that's how many molecules of bicarb had to be sacrificed to buffer, and you go through that. And once you understand what these numbers mean and what you can do with them, you can make assumptions. It's like peeling the onion off layer by layer until you finally get to the core and you've solved the whole puzzle.
So now you have these videos. I totally understand what you're saying. It makes sense. You show them to Kyle or other PA students in your course. Tell me a little bit about what you do when they show up. Like what does that experience look like since they've already seen your video on that topic?
Yeah, so they come back the next day, and now we can have a discussion which fits perfectly into flipping the classroom. So, okay, so now that you know that that the pH is this and the acid is that, what does that mean for this patient, this specific patient? How would you apply that information now to this? And now you go from just the linear learning of information to now applying it into a into real space, into the 3-dimension. So you go from the 2-dimension to the 3-dimension. It's like going from the second year of medical school to the third year of medical school, from the first year of PA school to the second year of PA school. You're now applying, you're not taking a 2-dimensional test with 5, you're now treating a full human being. And that's something that is the holy grail of flipping the classroom.
Do you, when you explain this to other faculty, are they, I imagine like there could be different reactions, right? So some might be really excited about it. Some might think, well, that's kind of weird. It's not for me. What are some reactions you've gotten from people as you've, you know, at your own institutions?
Everybody on paper wants to do it. Everyone likes it. The problem is that, you know, we're doctors, right? We hate change. And that's the way, that's the reason why medicine is the way it is because we hate change. It takes a huge amount of inertia to make change. And think about the way medical school is set up. Think about, I mean, medical school, what's the first thing that pops into your mind? Big lecture hall,
Yeah.
People standing up, people with notes being taken, writing. I mean, that's how we all grew up. That's how it was in college, right? I remember my biology class at UCR. There was like 400 people in the class, and there was one lecture. There's just no way you can have an interaction there. That's just because that's the way the system works. So people want to do it. I think people do have the right idea, and they have their hearts in the right place. But the system is set up not to really be conducive to that. And so if I do get blowback, it's usually because of practicalities. Like, how do you do this? With technology the way it is now, like we didn't have 10 years ago, I think it's becoming more and more a reality. And I think it's just going to get better and better.
Are you noticing MedCram getting picked up by your colleagues? Are they using the MedCram videos that you create so that they don't have to create their own? Is that something that you've noticed happening?
Yeah, just like with Osmosis videos, we're noticing that it's trying to fill a niche. The best video is something that takes something that's very complex and very intimidating and simplifies it so that it can be managed. What are some examples of that? Acid base is a big example of that. Lots of numbers, lots of arithmetic, very intimidating. But if you can tackle it and slay it, man, you feel such more empowered. What's another thing? Imagine a ventilator. A ventilator hooked up to a very critical patient with knobs and whistles, knowing that if you just click the wrong number or dial the wrong knob, the patient could die. Imagine being able to go up to such a ventilator in real life in a third year as a third year medical student and be able to say, okay, this is what's going on. This is what's going on with the patient. This is what the patient has. This is what we should do. And being able to make that connection. That's not something that you can really do on paper. That's not something that you can really do in class. As my professor would always used to say, a ventilator is something that you don't write the ventilator settings in the chart and then go to the ventilator to set them. You go to the ventilator and set them, figure out what you're doing, look at the patient, and then once you figured out what you're doing, then you go to the chart and write down the ventilator settings, right?
Right.
So that's
right.
that's a great analogy of flipping the classroom there. You're flipping the whole order.
Yeah, no, you're exactly right. And it's kind of learning by doing. And it feels like a lot of times, you know, in the classroom, it's just learning by, or not even learning, you know, frankly, a lot of times in classrooms that doesn't even happen because of attention spans.
Right.
And along the same lines, I've noticed a lot of your videos are pretty short. And I can imagine if I go and listen to most, you know, I'm at Stanford, most Stanford profs talking about acidosis, it might be an hour, 2 hours, you know, for what I could learn from you. And, you know, an eighth of that time. So there's a huge time savings piece as well, which I'm sure a lot of students appreciate. Do you, you know, as you reflect on how you like to learn and MedCram in general, are there future directions that you imagine kind of going in? Are there certain types of video content that you're hoping to kind of push forward into, or anything else that you're kind of looking to the future to doing that you haven't even done yet that you're kind of looking towards?
Yeah, so exactly. So we're looking at what's actually coming across the horizon. And one of the things that's really opened my eyes in terms of what's out there is point of care ultrasound. That's one of the big areas. I think that's going to probably be a quantum leap in terms of medical care. Imagine if you had to put the stethoscope on someone's chest and wait an hour to find out whether or not you heard crackles or whether or not you heard a murmur, right? And then all of a sudden now you could hear it in real time. That's the kind of, when we're talking about an x-ray or something like this, or an ultrasound or a CT scan, it takes an hour for that to turn around. And at the same time, we're getting data back in sepsis patients that the first golden hour of treatment is so important.
Yeah.
You can see that these timelines are matching up. So that is something that not only I believe, and I've seen evidence of this in terms of my connection with respiratory therapy programs. They're looking for respiratory therapists that have facile with ultrasound. Why is that? Because they're usually the first people there at the code. You call a code, the first people that are going to show up are the nurses and the respiratory therapists. And when you're dealing with a device that can more accurately tell you if the patient has a pneumothorax than a chest x-ray. If I order a stat chest x-ray, no offense to the stat chest x-ray guy, but I can get an ultrasound at the bedside a lot faster than I can get a stat x-ray. And I can actually diagnose it better. So I think what I want to do, and I think what you want to do, is we want to find the things in medicine that are going to have the biggest impact in terms of quality of care and life and outcomes. And we want to use our platform to educate people to their importance and hopefully into their understanding and knowledge. So that's where we at MedCram, and I've noticed as well as you as Osmosis, that's where we're going.
Yeah, and it's obvious that platforms like Osmosis and MedCram are much more nimble than a textbook, or that that we can kind of achieve these goals faster than a large institution like a medical school probably can, because they have a lot of moving pieces that they have to kind of align. So that's the advantage of being this relatively small in this space. So yeah, I appreciate that.
It's funny that you mentioned that. One student once told me, yeah, whenever I need to look up a topic, I type it into YouTube and I see the top choices, and whichever one not necessarily has the most thumbs up, but the one that is the shortest, that's the one they're going to pick. And yeah, it's pretty interesting. But then the other thing that they can do is they can just go to the little tool thing and say 1.5 times or 2.0 times, and they can get it in half the time. So I think what students today are looking for is they're looking for condensed information that's useful either to get a good grade on a test, which is legitimate, or to be a good healthcare professional in the shortest amount of time as possible. Why? Because more than anything else nowadays, time is so valuable. It's so valuable. Like you say on your site on Osmosis, you say, let's face it, we have other things that we have to do as well, right? Yeah. So let's try to get things done in a most efficient and timely manner as possible. And we believe that too.
Well, I think that's probably the best note to end on. I appreciate that piece. Efficiency is king, and you guys are striving for that. We're striving for that, and hopefully there's a ripple effect, and other medical educators, specifically medical schools, and other institutions will start to kind of do more and more of that as well. But hey, listen, it's been a pleasure chatting with you, Roger. I appreciate the time to kind of help explain what MedCram is. Thank you so much.
You're welcome. Thanks so much for inviting me on, Rishi. I really appreciate it.
Absolutely. Take care, guys. Bye-bye.
Bye-bye.